Good evening, everyone. This is Meldita. I'm back. And last time, I released my first video on losing weight, but I stopped for the time being because I'm planning to include lipoprotein. But this time, let's take a break and let's get back to ECG. Okay, so we have a case here of an infero-lateral STEMI. So we have a 67-year-old male patient with no cardiac history, and his chief complaint is chest pain. So there is a verbalized sudden chest pain while mowing the grass to the wife. So he stopped mowing, but the chest pain remains. So the wife called 911. So the ALS arrived. They did 12-lead ECG, and they saw an infero-lateral STEMI. So this is the one that they did, and we see that there's an ST elevation in the inferior, lead 2, 3, and F. But it's a mild STEMI. And also there is a STEMI or ST elevation in the low lateral side. So that made us say we have an infero-lateral STEMI mild type here. Okay, so the other crew member reported about this STEMI ECG to the hospital's cath lab. Okay, and also the cath lab team received the ECG, and they started preparing the cath lab for the patient's arrival. So they know that they have a STEMI coming up. Also, one crew checked if the patient has an allergy, and he said there's none. And so he gave aspirin chewable, as you know, aspirin. And also with the persistent chest pain, he also gave nitro spray sublingually and morphine sulfate IV, but no effect. But anyway, they are already on their way to the hospital, cath lab. Okay. In the cath lab, the patient had an angiogram done first. And normally, we know that we have 3 arteries that support the heart muscle. So we have here the RCA on the right. We have a left main that divides to LAD and the CIRC. So the angiogram results show that we have a blockage in the circumflex, and that is 90%. There is an LAD blockage of 40%, an ejection fraction of 45%, an EDP or end diastolic pressure of 16. And so they decided to stent the CIRC, and the blockage now is down to 0%. So they did PCI or percutaneous coronary intervention or stent insertion to the circumflex artery, and it is a success. We're not going to touch the LAD 40%. We normally stent if they are, less than 75%, except for the left main. Ejection fraction of 45%. Normally, we have an ejection fraction of about 60 to 80%. Some say 55 to 75. Okay, and this is about the fraction of the ejection, or the fraction of the end diastolic volume during systole. End diastolic pressure normal is 3 to 12, but we have 16. But so far, the patient is not in failure. And our TIMI-3 flow after the stent insertion is 3, which is good. 1 is no flow. 2 is sluggish flow. 3 is good flow. So we have a good flow. So we have a stent inserted, and it is a success. So the PCI is a success. Okay? So 1 hour after the procedure, 1 hour after we put a stent, this is now the change in the ECG. We notice that the ST elevation in the lead 2, 3, and F are now isoelectric, the ST segment. So with the lateral aspect, so it's now the ST segment now are isoelectric, and that is good. Okay, so the patient now will be transferred to CCU, and actually we do the ECG there post stent insertion. In some cases, some hospitals did do their ECG there, but usually CCU will do the first ECG after stent insertion. Okay, and the next video will be about the roles of the CCU RNs. Thank you.